The body's response to long-term chemotherapy, using chemicals to kill cancer cells. Chemotherapy is a cancer treatment method. Adults and children alike benefit greatly from this therapy option for a variety of malignancies. Before, during, and after surgery, chemotherapy is used to treat cancer. Using it as a preventative measure before other treatments like radiation or hormone therapy is also an option. If you have cancer, chemotherapy isn't going to get rid of it, but it can help minimize your risk of it returning. It's unfortunate that chemotherapy doesn't always work and has terrible side effects that are often worse than the cancer itself. The following are some ways in which you can avoid long-term negative effects of chemotherapy. What is chemo for? Chemotherapy is a form of cancer treatment that uses medicines and other substances to kill tumor cells. Before undergoing other forms of treatment, such as radiation or hormone therapy, chemotherapy can be used to lower the likelihood of developing breast cancer later on. Monoclonal antibodies, which are usually administered orally due to their low toxicity, but may also be administered intravenously. Antibiotics, which include antibiotics that work against bacteria as well as antibiotics that target specific microorganisms like fungi, viruses, and parasites. Adverse reactions to chemotherapy. Chemicals are used to kill cancer cells in chemotherapy, a form of cancer treatment. Radiation or hormone therapy patients can use this as a preventative precaution. Alkylating agents such as cyclophosphamide and carboplatin. Antimetabolites such as methotrexate, 5-fluorouracil, oxaliplatin combination chemotherapy treatment, which prevents relapse after initial remission in patients with platinum-sensitive disease or when combined with further chemotherapy treatments. Plant alkaloids such as vincristine and anthracycline, and doxorubicin, which is used to treat ovarian cancer. Tumor forms, such as monoclonal gammopathy, osteolytic bone metastasis, and disseminated carcinoma affecting several organs, influence the choice of chemotherapy plan. Weight loss. This is the most prevalent complication of chemotherapy. Chemotherapy causes the body to lose 10–20% of its weight because cells are being killed at a rate quicker than replacements can be made. Infection from the chemomedicines themselves or your immune system's attempt to fight off the invaders are two main causes of fever, which is another common side effect. Under your armpits or on your abdomen, you may see redness and swelling as a result of chemotherapy. This will have an impact on the amount of food and fluids patients can consume in order to stay hydrated, preventing chemotherapy side effects for a longer period of time. Relax and distress. As chemo progresses, you may become more susceptible to infections and other side effects. Make sure you're eating well. Chemotherapy patients often say they feel better after switching to a diet rich in fruits and vegetables. Maintain a healthy lifestyle by getting adequate sleep and exercising on a regular basis. Side effects like exhaustion, nausea, dizziness, and dehydration can worsen if you don't get enough sleep or activity while undergoing therapy. If you observe any changes in your symptoms or health state, don't hesitate to contact your doctor. Take care if you are on any prescription medications that may have an effect on your long-term health, including blood thinners, steroids, or antidepressants while undergoing therapy. These recommendations will help you avoid long-term adverse effects of chemotherapy, so you can focus on mending yourself instead of worrying about your health. Cancer chemotherapy's main side effect. Chemotherapy patients frequently experience nausea as a side effect. Having this symptom can make it difficult for people to take their prescription and learn how to manage their therapy on their own. Taking your prescription with food is the best approach to avoid nausea. Rather than swallowing or spitting out the prescription, take a few sips of water or ginger tea to alleviate symptoms such as dry mouth and constipation. Consume plenty of fiber-rich meals including fruits, vegetables, whole grains, and lean meats to keep your bowels regular and prevent constipation. Chemotherapy can also cause hair loss as a side effect. If this is the case, you'll want to adopt healthy habits, including limiting your exposure to the sun's ultraviolet radiation and consuming more water. Hypotension, or low blood pressure, is another typical side effect of chemotherapy. Regular physical activity and plenty of water are the best defenses against low blood pressure becoming an issue. Reducing the dosage of your medicine by half may help alleviate dizziness. As a result of chemotherapy, anemia is a common side effect that can be alleviated by consuming iron-rich foods such as red meat and poultry, as well as dried fruit, dry beans, lentils, and dark green leafy vegetables such as spinach and kale. Conclusion: chemotherapy that is given for an extended period of time may not always produce the desired results. These side effects may be as bad as the malignancy itself in terms of severity. These harmful effects can be avoided, but there are ways to do it. Here are a few pointers to help you stay healthy while undergoing long-term chemo. 1. Make sure you get plenty of sleep, drink plenty of water, and eat a well-balanced diet. 2. Take antioxidants, selenium, and zinc supplements. 3. While taking chemotherapy, it's important to be physically active. 4. Keep in touch with loved ones and friends via phone, email, and social media. All in all, the value of chemotherapy far exceeds the side effects or the inconvenience it creates.